Right now, we have about 450 beds, okay? This is an aerial photograph of how the new hospital is planned. It is a series of pavilion-like buildings. You see these square objects along Pasture Mall. If you look in the center of the side, you see the blue square. That's the existing fountains in front of the old 1950s portion of the hospital. And you'll see at the sort of intersection of those front squares is the entrance pavilion of where you enter the hospital, and upon entry, you immediately see and locate a very large internal courtyard which orients the entire facility. So we're bringing nature right into the center of the new hospital. This is an elevation or a view of what the new hospital would look like. The lower two levels, which will be clad in a historic-looking Stanford stone color, similar to the rest of the campus, is where our diagnostic and treatment facilities will be. The first floor is where the emergency room is, and our imaging or radiology department. The second floor is where surgery and interventional imaging will be. And then above that, which is the standard height of the rest of the Stanford campus, is what we call the garden level. That level will be, there will be some services in that level, but a lot of that is the roof of the very large diagnostic and treatment portion. That will be a roof garden with outdoor access. And then the public spaces there will include dining, retail spaces, spaces for social service and other activities where we interact with patients and families, our chapel, our palliative care center, and conferencing facilities. And then above that garden floor, you see the 3 floors above that in sort of the wood or reddish color. Those are what we call the hospitality section of the hospital. Those are where the patient bedrooms are. And those are all private rooms, and all rooms have family rooming in. So abilities for family members to sleep in all acute care rooms and in our intensive care rooms. The entry experience is very, very important, especially in elderly patients who have to orient very clearly to where the front door is, how you get in and out of car and enter the building and orient yourself. And what we're providing, this is a rendering of the lobby. Many of you have maybe seen this in some of our publications. You come right into the building, and the first thing you see is the garden. The garden is sloped. It goes from the first floor up to the second and third levels of the building. That slope will be emphasized with a major water feature. So you'll not only see nature in water, but you'll be able to hear it, which will dampen some of the aberrant noise factors that happen in these hospitals and help with people who have hearing impairment. And you can see the clear access up to the surgical level through escalators, and then very clear elevators which look out onto this courtyard. So at all times you know where you are in the hospital. No more long corridors that go nowhere. This is a plan of the first floor of the building. The blue is the water feature you see in our courtyard. There are only 2 departments on the first floor, the emergency room. The new emergency room is about 3 times larger than the current emergency room, but it doesn't see 3 times as many patients. It sees about 20% more patients. We need that much more space just to handle the volume we have now. Many of you have been to our emergency room. You've been on a gurney out in the corridor because there's no rooms, et cetera. We need this kind of expanded space just to handle our current volume. The purple portion next to it is our imaging department, which is so patients from emergency can go directly to imaging for service. And then the yellow in the corner is where our dining facilities will be. They will have outdoor access to nature, and there will be a portion of dining that will be available 24/7 for patients who are visiting the emergency room and their families. Things we don't have now. Our second floor, our interventional platform, will be one of the most advanced surgery and interventional imaging departments in the world, and those centers will actually be all within one location. So patients won't be going to imaging for certain vascular things and then go to surgery or whatever. All those things will be together. They will have shared waiting. They will have shared pre-op and post-op functions. So they allow us to go from more open, invasive cases now to more interventional imaging-type surgical cases in the future. And that department is about, to tell you the size, that floor plate is over 3 acres just on that one floor, which gives us lots of roof garden above. That patient or roof garden floor is really a space for reflection and for social services for patients and for our staff. The gray portions you see on that garden floor are actually mechanical units that bring air down to the surgical platform. So we need a lot of stuff to actually just serve that lower level. But everything in between the yellow space around the courtyard, our dining facilities, our resource library for patients and families, our palliative care center, social service offices, areas for our chapel, a contemplative garden space outdoors next to the chapel, and our area for conferencing facilities. So this middle floor is sort of our support floor for the entire hospital. And this shows what that floor will look like. There'll be retail and these other services, our connections between them, and then access and views out to the garden space on the roof. The other nice thing about that service, that you can, if you look out the view to the far side, you see the mountains. Because this is about 50 feet up in the air, it is the roof line of the rest of the campus, you will be able to see forever from this floor. It's going to be one of the best views in Palo Alto. It's also why we need our city variance for doing a building taller than 50 feet in Palo Alto, which many of you have been reading about. In the patient care rooms, almost everything Betsy mentioned are things that we're looking at to provide better patient rooms and services. All the rooms are private. They have family spaces and rooming in. They have nurse locating devices. They have bed railing issues that are specific to service both ADA patients and the elderly. The upper units are a series of pavilions. They are connected by glassy bridges so that when you leave one nurse's station, you see view of nature and outside before you go into the next nursing unit for orientation. The darker blue units are our acute care units, and the lighter blue units are intensive care units per floor. And as you can see, they surround this internal garden function, and the yellow portions are the elevators that are within that garden. Within the patient rooms themselves, we are providing the sliding door issues that Betsy was talking about. We are providing patient entertainment systems for both families and patients on one large screen. And the family rooming in, we will have window seat sleeping elements for families in every room. These are examples of different designs that are going on around the country in patient rooms. The room towards your left is very similar to the rooms we're designing, with patient toilets on the inside of the room and direct closest access from the bed and visibility to the toilet and the bathroom. So this is actually a photograph of a quick little model we're building right now. We're right in the design phase of these rooms, and it shows you the sliding door mechanism to the bathroom, the view into the toilet, the European shower idea, which is basically that the floor of the bathroom is the shower element, so you don't have to step up in and out of a shower. It also allows the nurse to bathe the patient and have much closer access. So all the sort of things that we're doing nationally to try to improve these kind of facilities for the aging patient are things that we are providing in the design of the new hospital. So that shows you sort of what we're trying to do in our design process. The other thing is we are actually in the design process now. So your questions, advice, and input is very important to us on things you want to see in the design process for the hospital. So we will open up for questions and answers. Thank you very much.